Okay, depending what kind of procedure it is, how long it is, the patient may wake up and they may have a urinary catheter in place. If it's a very short procedure, they may not have um, a catheter in place. So that's something the nurse needs to assess while they are in PACU. So what's a normal output for urine? What color should it be? If a patient had a lot of fluid in the OR, what would you expect for output? Um, Wounds are another thing the nurse is going to assess while in PACU. How many? Where are they? Um, have they been looked at? Are they sutured in? Are they draining? Are they not draining? What are they draining? Is it blood? Is it serosanguinous? These all have to be looked at. A thing about wounds is dehiscence. You need to assess that. If the dressing is on, then don't take the dressing off, but is it bleeding through? Is it dry? Um, Dehiscence is when the wound comes apart. Okay, drains. How many drains are there? Where are they? These are all factors and things that the nurse will assess. It's important to assess because when the nurse gives report to the nurse on the med surgical floor, then these are all things that the nurse needs to give in report. Here's an example of a patient that has two drains. These are the ones that I can never remember the difference of them, but this is the one that's like a hand grenade. You basically um, take the plug out. You can now push all the air out, put the plug back in. It's like a hand grenade, and it basically slowly sucks the drainage content in there. So, post-anesthesia discharge criteria. A patient will not be transferred to the floor until they have met this criteria. So patient is awake or at baseline. Now, does that mean they're fully awake? No, but they are arousable. They can open their eyes. They're not completely zonked out asleep. So maybe not their baseline. They're sleepy, but they are awake. They can respond to commands. They can open their eyes when asked to. Are the vital signs stable? Meaning, if they had hypotension, has that been resolved? Did they get fluids in the PACU? There's no excess bleeding or drainage, meaning there's not frank blood pouring out of the drain or out of the wound. So is this stable as well? There's no respiratory depression, meaning the patient's able to ventilate. Patient's does not have a problem with obstruction of breathing. They're breathing a normal respiration rate. Oxygen sats are above 90. That's all right if they're on oxygen. A lot of patients come up from OR or PACU and they're still on oxygen because they're still very sleepy. So this is the information. The report is the information that's given to the nurse. This is what the nurse needs to receive for report. Because the nurse now takes over their care. If it is an ambulatory surgery, meaning a day surgery, you're going home, you have a little bit different discharge criteria. So basically all the PACU discharge criteria is met, so the one on the previous slide. They've not had any IV opioid drugs for the last 30 minutes. Doesn't mean they're not going to take any PO when they go home, but just the last 30 minutes they've been able to go without any IV opioid drugs. They have minimal nausea and vomiting. Notice it doesn't say it's absent. Some people are bothered by pain meds and anesthesia, so that could be that could still be there. Doesn't mean it's away. Voided. If it's appropriate for these patients, according to the procedure. Not every patient has to void before they go home from ambulatory surgery, but whatever the procedure is, the closer it is to the pelvic area, the higher the risk that the bladder will also have a hard time waking up and doing the job that it needs to do. If they're able to ambulate, this is age appropriate, and also is it needed for the patient to be able to do before they go home. And it may be age appropriate if somebody's very elderly. Maybe that's not the most important thing, and it might be dangerous and not safe for them to ambulate. Usually you need a responsible adult to accompany the patient or drive the patient. They're not allowed to drive home. And discharge instructions are given and understood. This is pretty funny. They usually rattle this off. The patient's having a hard time waking up, or they still have some anesthesia on board. Maybe the patient was given Versed for the procedure, like a colonoscopy or something like that. And Versed, of course, is an amnesiac. The patient's not going to remember anything that's given, so it's good to have the driver there. Plus, it's all written down, and the patient could read it later. So this is what the patient needs to accomplish for ambulatory surgery. So going back up to the patient that's going to be admitted to the floor. Patient comes up to the med-surg floor. Let's pretend you are the receiving nurse. What do you need to do? Well, ahead of time you need to get the room ready, so whatever you need. So it could be you have to have your Dynamap in there, you need your IV stand, pull. You get the patient transferred to bed, you do the vital signs. Remember, pain assessment is part of the vitals. So if you know in report and they tell you the doctor has already ordered a PCA, hopefully before the patient shows up, which is typical, usually the orders will be faxed to the nurse. So before the patient even arrives, they'll have the orders for the PCA, and the nurse can get the PCA set up so they're not waiting on that when the patient arrives. They're going to assess the same kind of things as in PACU, so airway, breathing, circulation. Are those all within baseline normal limits? The nurse needs to do the admitting assessment. The admitting assessment is done by the RN. It's not done by an LPN or a nurse assistant or a CAP or a student nurse. Protocols that need to be followed. Different floors have different protocols depending on the kind of surgery. So there just may be something that's standard for that floor that every patient has to have. Is there any nausea and vomiting? Does medication have to be given for that? These are things that the nurse is going to look at and make sure everything is taken care of. It's important to take care of these things and assess them right when the patient comes up before the nurse then goes and takes care of all the orders that the doctor has written.